I just want to introduce Professor Dr. Jorgos Kavouras, who is in Germany and has been working with accumulators for most all of his professional life, a very long time, has an extraordinary amount of experience, and I'm very happy to have him be talking to us today. So we can maybe start the Zoom meeting.
Can you hear me?
Yes, we can't see you
Yeah.
yet, but we can hear you.
It's something funny happened because I have two computers, and yesterday one is on the left side, one is on the right side. And yesterday had the transmission to the left side, so I was preparing everything to the left computer, and now you came from the right one. So I had to shift everything here quickly, but I'm glad you can see me. Okay.
Yes.
Anyhow, uh, let me go back to the human being and um, and say how important these what we said yesterday with the orgone device, alone with the orgone device, uh, what we can do. You saw, and I want to give you one more example from the doorbuster, uh, where I had another case. Actually, the doorbuster, of course, is of a lot of use in all the cancer patients. So here's a case of a young girl, 16 years old, who she had a severe lumbar and sciatic pain for more than 2 months, with a beginning paralysis of the foot. She had foot drop without any tendency for improvement. Pains were so strong that she could hardly sit and walk only a little bit. A 16 years old girl. So she could not go to school. She could not go to sport. She was very much in sport. She was treated with injections, also cortisone, partly immobilization, physiotherapy. And despite all of these measures, she was aggravated. So there was a dynamic to the worse. There was already a surgery planned if her oral cortisone therapy would not be successful. And in that state, she came to my clinic seeking our help. And actually, she was sitting in front of me. She couldn't hardly sit in the chair, and she couldn't hardly walk. So we set her to the doorbuster, and of course, um, we treat the spine, and many times you find more than one block in the spine. The major block is many times where is the pain, but many times the major block is somewhere else. So you have to treat both the spots in order to bring energy move again through the spine. So after the first doorbuster session, now she was sick for far more than 2 months. She came home and she let herself fall in the armchair. Her mother almost get a crisis because she thought, "Oh my God, she shall not do this." After second session, the pains were permanently ameliorated, and the paralysis went away after 2 or 3 sessions. There was no paralysis anymore. The quality for the doorbuster for the nervous system is especially high. I have seen when we had nerve cuts which would not reconnect one nerve part with the other one. The doorbuster was making the trick without anybody was believing before that it could happen. So sometimes in surgery they cut by accident nerves and then the extremity is numb. And we had several of these cases where the doorbuster could could make the two nerve ends find each other again and connect them. It's unbelievable. It's not the doorbuster alone, of course, but the doorbuster brings out the block, and the Orgone-energy can go through the region again and make the healing. So the doorbuster is like the cloudbuster in the atmosphere, which it just gives a chance to the system of self-regulating itself again, which is the best you can do. So after 10 sessions, she could come back to physical training for the first time after 2.5 months, and a few more sessions, and the girl was totally cured. I saw her back half a month again, half a year again, and 1 year again, and she was having no pain at all. So here you had a case in a young girl, of course, where the capacity of healing in a young girl is better, but she had such a severe block that I had not the chance to treat her by psychiatric treatment. She was just coming for the doorbuster, but in this case, the doorbuster was enough of tearing out the block and helping her. Of course, what I'm doing always, I advise people for a deeper kind of breathing, because of course, as you know, when you breathe deep, as all of us should do, um, then the energy can circulate better and the doorbuster is working better. So another case which was quite impressive was a 66-year-old lady had very strong pain in the right knee. She had had an arthroscopy 2 years before with cartilage, with smoothing of the cartilage, and a half a year before she had again arthroscopy with no diminishing result on her pains. Well, actually, the pain was stronger than ever before. She had intra-articular injections, and unfortunately, she got a joint infection, bacterial joint infection, from the injection, which is a risk which is known. So she received joint irrigations and systemic antibiosis, but the joint, the knee joint remained stiff. So she came back to me because former times she had been with me, and she, you know, the miracle, not the miracle, but the interesting thing is that the patients who once have been at the doorbuster, they always come back. So once they had a good experience, and most of them have a good experience, whenever they have something again, then they come and seek. So sometimes I don't see the patients for 10 years. After 10 years, they come and say, I want to go to the doorbuster. So they come just for the sake of the doorbuster, not to see my face. They want to see the doorbuster. So she came back and she said, "Can you help me? My knee is stiff. There was still inflammation in the knee." And after a few applications of the doorbuster, there was already strong amelioration of the pain, of the swelling. And uh, after an end of a series, I don't remember, maybe 15 treatments, there was a very, very good functional result with a better possibility of movement than in the whole last year. So the stiffness that came due to infection was reversed, and better than that, she came back to a state she had been 1 year before. So you see, the doorbuster, of course, is very, very beneficial in the hands of somebody like the cloudbuster is, who knows how to treat with that. It's not as complicated as the cloudbustering, but still you should know about biophysical biophysical state of the patient. And this was actually one of the reasons I was learning psychiatric orgone therapy, because I wanted to understand all of what Reich was doing. And I said, I can understand and I can do the work with the doorbuster only if I understand the psychiatric work as well. And as I said, I had a wonderful teacher, Morty, which many of you were taught by him, and he was a wonderful therapist and teacher. So let me summarize. Um, what we see in our bodies is reflecting what is happening in the atmosphere. So with all we have learned here, we can help our world, because the measures that are taken now in reducing the CO2 will not help. Will not help. Not in 1,000 years, because the door concentration is getting much quicker, so high that the reduction of the CO2 will not have any effect. The only effect I see is that we enhance water circulation again by planting trees, by caring about the atmosphere with the door bustering. And I'm looking forward to what Connie will say later in the day. And I believe that the doorbuster for the human being and the cloud is what the cloud buster is for our nature. And we should be working very carefully with the cloud buster, of course, but it gives a chance to humans to survive. Okay, this is my belief. Once in my last conference, there was somebody telling me a joke. We were talking about the same things, and he said to me, "There's a joke. There are two planets are meeting each other in the space, and the one planet says to the planet Earth, 'How are you doing?' He said, 'Oh, I'm not doing so well. You know, the humans.' He said, 'But not for much more time anymore.' So it was very okay. When I believe we have the time to change things because we have so strong weapons Wilhelm Reich was giving us. We should just use it with the idea, and we should have people like Roberto also who give us the idea of how we can measure, how we can see how high is the door concentration, in which altitude, and then we can control what we are doing. And you will see what I see now in Namibia was really convincing me because it's a sustained effect of one OROP for one operation, which was in November, and still lasting the effect. So thank you very much for listening, my dear friends. It was my pleasure to talk to you. Thank you very much. Thank you. You're very welcome.
It's so great to see you. Thank you, Jorgos. I'm
Yes,
glad you were
good.
able to get the other talks. Yeah,
Thank
it's
you very
really
much.
teaches a lot. So stay well. Yeah, and we'll talk again
Yes,
soon.
right. No, I have to say one last thing. The one thing that brought my health back was the doorbuster. So I decided from one day to go twice daily to the doorbuster. Now I have done it for more than 1 year, and I can see how my health steadily improves. Really, it does not help only my patients, it helps myself as well. Okay.
Thank you. Thank you
Yes,
for that.
you're welcome. You're welcome. Thank you. Thank you. It's my pleasure.